We take you back to the stories and our watch this morning on the agenda. Earlier on, we had spoken to our reporter, Patricia Visagie, who's hot on the heels of that disaster that happened in the East Rand yesterday. We understand now that, of course, Mr. Joe Phaahla, who is, of course, the Minister of Health in the country, is there right now. This follows that walkabout that they had this morning. Let's take you there now and find out what's happening.
Fallen by this tragedy, as all of us have seen the reports unfolding. So we will just do just a brief update in terms of where we are. As far as where we are now in terms of the briefing, as indicated, here in the hospital, 37 people were admitted. 24 being patients from the community, from the surrounding communities who were affected by the fire, as we know, and 13 were also staff members who were also victims of this fire. Most of it, as you have seen, the area where people who were affected outside at the parking lot near the accident and emergency area where the explosion happened, and people suffered very severe burns. We are told that even for those who have survived, many of them have quite severe burns, so it's still a long way to go. Some of the other victims of this were diverted to other hospitals, and indeed we are very pleased that other surrounding hospitals also assisted, including private hospitals. So we'll still get a full tally of the number of patients who were taken by other hospitals. In terms of fatalities, as of yesterday, the report we had was that 10 people all in all had succumbed to this fire by yesterday. But the update which we are getting for today is that this number has risen to 15. 15 people now as of this morning. And we want to take this time to really pass our condolences to the families, the loved ones. We are informed that amongst the deceased are also children. So it's adults and children. It's indeed, at any time, it's really a bad thing to lose family members. But, it's even worse on the eve of Christmas and also on Christmas Day that so many people have passed away. 3 of those who have passed away, as we will indicate, are also staff members of the hospital. For those who are still recovering, we wish them speedy recovery. So far, 13 members of staff are amongst those who have suffered the injuries. So we will be following up together with our clinical management and the employee health and wellness unit to make sure that those who have been injured will be well looked after, also including not just for themselves, but also the welfare of their families. As I've already indicated, 3 of those who passed away are staff members of this hospital. Amongst them, it's a driver and 2 enrolled nurses who were severely burnt during this incident yesterday. Now, several staff members, as we said, have been affected, largely in the parking area. As we were walking, you would see that the parking area in front of the casualty was quite exposed to where the explosion happened, and that's why people who were either going towards their cars as the fire was coming, trying to rescue their cars, were the ones who were quite badly affected. Now, in as far as the hospital itself, the hospital remains functional. We'll say a little bit more about what is the future, but the hospital does remain functional. We do have patients in the hospital. At the current moment, there are 321 patients who are admitted in the hospital. Since the incident yesterday, there's been no new admissions so that the situation can be stabilized. So patients who are coming here, in the case of absolute emergency, they are attended to, but they are largely diverted. And we also appeal to members of the community who generally use this facility to use other clinics and hospitals in the surrounding until further notice, when the services which can be continued at this hospital can be well established. So for the current moment, most of the services are suspended, and we advise the surrounding community members to use adjacent facilities. In as far as the damage to the structure of the hospital, there is indeed very significant damage, as we have seen in the accident and emergency area. We've also seen in the X-ray department where the roof and the ceilings have collapsed, broken windows and other broken equipment. So as we have seen, that's largely where the damage is, the roof, but even in the roof mostly is the ceilings which have collapsed and the windows. At this stage, we are optimistic, even though we await the experts, the structural engineers who have already been on the scene, and they are going to be continuing to do their assessment. We are optimistic that the major structure of the buildings of the hospital hopefully will be found to be still sound, that it can be salvaged. That's just from a naked eye assessment from ourselves, but we are not the experts in this regard. But we're hoping that when they do complete their work, they will be able to confirm that the main structure, the main infrastructure in terms of the walls, and even most of the structure in terms of the roofs of the majority of the area of the hospital, we are very optimistic that it will be found to be still intact. But as a precaution, the Department of Labor has given us a prohibition notice in as far as the areas which have been quite adversely affected, that is your emergency section, your accident and emergency division, where we have seen a lot of damage. So in as far as those areas, we are not allowed to operate in that area until all this assessment is done and all the necessary repairs are done. So as I've said, the structural engineers have already been on the scene, but more work will be done to actually confirm the extent of the damage and what can be repaired and what needs to be, what can be salvaged and what needs to be replaced. So we are looking at maximum by the end of this week. We know it's a very difficult time. This is also a time when your construction industry is on a recess, as from the 16th of December. But we're very grateful that some of those professionals could be accessed to come and make the assessment, notwithstanding the builders' holidays. And they will be here even tomorrow and over the week. At the maximum, we expect that by the end of the coming week, we should be able, the MEC, to get the full report of the extent of the damage and what can be done in those badly affected areas. So going forward, our infrastructure team will be working on maintenance work, looking at where some of the buildings, as you would see, even this block where we are, the administrative block, some of them is just the broken windows. So some maintenance work will carry on immediately. And then, of course, the major capital work, which will come in once the engineers have done their work and have given the report. But at the same time, Also, medical equipment. You would have seen, as we were doing the walkabout, that one of the affected areas is the X-ray division in the emergency and accident and emergency unit. Again, from the layman's naked eye assessment, the equipment themselves look like, probably not badly affected. But until the experts have examined them, seen that the electrical works, everything, the actual functioning of the equipment is still okay, we will not be able to say so. So we'll need this time just to assess that, but we are optimistic that they will be found to be still in a working condition so that they could be brought back to work. So at the current moment, as we have said, for the patients who are already admitted, they will continue to be looked after. Our staff will be here. They are here. As you would have seen also, the casualty is now also moved so that there's still a service which can be attended to in the outpatients section. So those who are already in the hospital will continue to be looked after. But again, we want to repeat that members of the community are advised that any new service required, we ask them to use adjacent health facilities. And we want to also take this opportunity to thank the non-government organizations which have come, to assist in various ways, in terms of some coming with supply of fresh water, some consumables, not only bringing some support into the hospital, but also in the surrounding community. It's indeed very devastating. I mean, nobody wants to be exposed to the kinds of scenes which were there yesterday, and we're very, pleased with the support of the NGOs which have come forward to supply fresh water, to supply food and other consumables. And we thank also members of the community which have been sending us messages of support to our traumatized health workers. We must thank them that, notwithstanding the trauma, I don't think anyone really would want to be exposed to the kind of scenes of what happened here yesterday. Seeing some of your colleagues, burning in front of you and not knowing what's going to happen to them. And as we have seen, we have reported now, 3 of them have succumbed. So we're very grateful for all the messages of support which we have been receiving. Thank you very much. I'm sure the MEC would like to say something also as the custodian of this facility.
And I think, Minister, you have covered a lot of things that I would want to say, especially on the issues of the structural damage and the interventions that are expected now on the side of the provincial government, national government and local government, because I think we'll be working in collaboration, all of us, to ensure that this disaster that has happened, at least the families are aware that government do care, because I'm sure that's the expectation that they need out there. And I think already the team has been communicating with some of the family members around the area, including the communities, just to assure them that government is there for them, is working with them, or will make sure that we normalize the environment. It's a painful thing, Minister. We all agree it happened at the wrong time. Because these things are not planned, how we wish we knew so that we can make sure that this doesn't happen. And it has happened, and we want you to really thank you, all those that have been working since yesterday with the communities and with the staff in the hospital, as Minister was saying. And we even appreciate the messages of support. And we want to appeal again, as Minister have indicated, please let's allow our teams not to share on social media those pictures that what has happened yesterday. It was really bad, because some of the family members were still not aware what has happened to their families, but already there were pictures that were out which were not good at all. So we want to appeal to those that have done that. They must delete those pictures. They must not resend them, because it's not a good image of what it should be. Lento kuthiwa ngubuntu xa kwenzeke into enje. Siyabonga kakhulu. Thank you, Minister, for the opportunity.
Thank you, Minister and MEC. Colleagues, there's the latest update. I'm not sure from members of the media if there are perhaps some follow-up questions or clarity-seeking questions. You can just raise your hands and then I'll just acknowledge you. Maybe just mention the media house and your name as per on usual protocols. And then I see the first hand, or I see some 1, 2, 3. I'll say 1, and then 2, 3, 4, 5. There's 5 hands that I will take. I'll start on my right hand side, this side. You can start this side.
Okay.
Yeah.
From Africa. Minister, if you could kindly give us a breakdown of the number of patients that you have in different hospitals. So, for example, in this hospital, how many patients do you have? I know some of them were taken to Barra, others are in the Far East Rand Hospital, and how many of those are in ICU? Thank you.
Okay. And here, 1, 2, 3, 4, 5. You can come.
Hi, Minister. It's Dennis from Netwerk here in Winter. Minister, I just want to know from you, is there a time frame from what you've seen today? Is there a time frame for how long this hospital will take to be fixed? And secondly, given what happened in this community, would you say that it is especially in need for the community to pray for each other and for the country to pray for the community of Boksburg after what happened here?
Okay, the second one here. Yes.
Good morning, something from the SABC. Minister, do we know how many people have perhaps reported some of their loved ones missing? And what type of help will those who still do not know where their loved ones are, who are still in search of them, is there, I don't know, any kind of help? Who can they approach just to get that information out there?
Okay. Yes.
In terms of resources, you indicated that you are still assessing, but you've seen the extent of the damages. In the short term, which resources will be prioritized to the hospital to minimize the impact and of service delivery, especially because this hospital services a lot of people. Yesterday, families indicated that they had not identified their loved ones. How many families have so far identified their loved ones?
I think there was a hand there.
Sir, I'm from a local NGO, the NGO. I just want to find out, we've been assisting the hospital staff and the residents with food and necessities. What's accessible to us in terms of, from a government point of view, to access necessary food and whatever it is that's necessary for the staff that's coming from people's pockets at the moment? Is a government funding accessible to us from an NGO perspective?
And another thing from the NGO, we have been local work in the area for all welfare work for many years. And we've been on the ground since yesterday, assisting, coordinating with the doctors, helping even the families that we pass now that are looking for missing people. So now we've visited all the homes, assisted the homes, assisted them emotionally, financially, with food, with whatever needs. What has government done thus far in this time frame? And what have you all to offer to us on the ground? And especially like the lady said now, are we sorting out this hospital is important, or it's just going to be one promise? It's not going to be, it will be promised now and will just be shut aside, or maybe it will be used up as corrupt money like out of the Visa hospital or something.
Okay, I think those were the 5 questions. I think the last one was more not necessarily a media question from the media, but I think it's a question that the officials are here that probably would have to engage with the colleagues so that they get connected with the relevant people who are managing the relief efforts. But I'm sure the minister and the MEC. Sorry, sir.
There was nothing being done on government side. We are still here from 8 o'clock in the morning. Well, yesterday from.
Can you allow us to run the media?
You are saying something, but say the truth.
Yeah, can you allow us to for the principal to be able to respond? Otherwise, if we're going to have a dialogue I'm going to have to ask you to at least be on the side, because the media briefing, we've been given an opportunity to be heard. Allow the principals to be able to respond. Sorry, sir, I'm not going to have a dialogue with you. Otherwise, you'll have to step out of the briefing. It's a briefing. Allow the principals to respond. You will be heard. You'll be given an opportunity to respond. If I can allow the principals to be able to respond. I think some of the questions, there are officials who are here who should be able to provide the technical responses on some of the specifics that were asked. The issue of the facility, how many patients are at different facilities. We don't have to start with the questions in that order in which they came. Let's start with the questions that can be responded from here, while the colleagues are collating that. Remember, there was an issue of time frame for fixing. We are going to come back to that question of the number of patients as the update is still being given. But I want us to deal with the issue of the time frame for fixing the facility.
As I've indicated, it's impossible to determine the time frame of that we will take in terms of the fixing of the facilities which have been affected before you have an assessment by your professional teams. What we can see now is what a lay person like myself in the built environment can assess, the shuttered windows, the ceilings, but you need that report of Mr. Dagala from our infrastructure and also from the provincial team who are working with the engineer, the structural engineers. And as I've indicated, at the very latest, by the end of this coming week, notwithstanding the fact that this happens at the time of in the Christmas weekend, by the end of the week, they will provide us with a full report arising from which we will be able to know, especially your badly affected area, your accident and emergency area, which is quite the most badly affected. The other areas, they will look at the rest of the facility because there's been a blast, and therefore, when you see broken windows, you know that the building was shaky. From the naked eye, you may just think it's just broken windows, but those professionals will be able to check the walls, check the roof, and check everything to make sure that everything is intact. At least what we can see is that, as I said, the positive thing is that from the layperson, it looks as if the main infrastructure is still intact. There's been no, we have seen there that even your standby generator is still intact. Your electrical supply to the hospital, we still have our lights here. The water supply is still running. There were no burst pipes. So that is basically a very positive sign. But in as far as those areas which are having some wires hanging and so on, and all those, it's until when we get the report that we can be very firm. What we can assure you is that once that report, as that report is coming, in anticipation, we are working together looking at the possible sources of funding from national grants, from the provincial infrastructure funds, in anticipation of that report which will be coming, so that when the final report comes of what are the things which needs to be attended to, that work is not going to be waiting. That, as far as that part is concerned.
Another issue, Minister, that they are asking, which I think I can clarify, they wanted to know which hospitals some of the patients have been diverted to. Some of the patients are at Bethel Kowa Hospital, Far East Rand Hospital, Landmed, and the three that were critical, they were airlifted to Para, Chris Niparapanath Academic Hospital, and then Charlotte Maclake Academic Hospital. So those are the ones that we know they are there. But we will still communicate with the families so that they are aware that they are there, because we will not keep quiet so that they don't know what is the status of their loved ones in those specific hospitals. I think that's the area that they wanted. And it depends on the type of injury that they received, Minister. That's why we had to identify those specific hospitals where they will be assisted. I think there is a program that we've agreed with the team, the one that is going to assist even the colleagues that are working in the hospital, which is going to be involved counseling, which is an EAP program that is led by Dr. Snaba. He is here already. That program is going to kick in, but it's not only going to be for the people that are in the hospital, including the families are going to be part of that program. Hence, we already do the intervention of checking which are the households that are affected in the area. And our teams have been there in those areas. Colleagues from the NGOs, they want to know that they've been assisting the families. We do appreciate the work that you've been doing in assisting the families. But we are saying, even on our side as government, we will assist the families. But we can't identify now what type of a family of help will do, except this one that we are sure of counseling, that it's an immediate thing, definitely, that you need when you have lost your loved one or your loved one have an injury. It's something that you can't run away from it. But then I'm sure the team, Minister, from our departments, they can have a session with the team from the NGOs, exactly to identify what is it that they want us to do. Because we will not know what you want us to do until we have a session with you. Because what you have been doing first, it was out of love. It was because you are community members. It's part of your work that you are doing. But we have a Department of Social Development. After this, I am going to communicate, because even the provincial government was here, led by Premier yesterday. We will definitely rope in the Department of Social Development to assist if there is no food, Minister, because those are the basic things that that department does in a family, besides other things that we can do on the other side. Even ourselves as Department of Health, there is nothing that stops us if we find in a family that there is no sugar, there is no tea, especially if somebody has died. That's what we should be doing, but we will bring in the relevant department to assist on that. But I want to appeal to colleagues who have been helping families, don't despair, and I don't think it's the time for us to start fighting or pointing fingers at each other now. If you want to build and work as a collective, why here as government, we will definitely do that, Minister. And I will want colleagues again to know, we will be working with the Department of Infrastructure Development. This hospital has been part of our OHS program that we're prioritizing. I know in the team they are here, or Dr. Snaba, they can confirm, and Dr. Mankopane, Minister, that we said we're going to start with Tambo Memorial because of the asbestos that is here. So it's number one now in our priority. It was number 10. We changed it to number 1. So it's part of the work that we're going to do. We're not doing it because of incident. It's something that we were going to do because we believe that that must be done by government. Where you see that there is a problem, it's your role to assist and prioritize the hospital. So we'll definitely be doing that, working with DIT, Minister, and you will get a report. But your team, Dagela and the others, will be part of that team. Because that report now that we must do in any work that we must do in the hospital, as you have said, it must be led by the report from the structural engineers. We can't do it on our own. But fixing the windows, I don't think needs a structural engineering. It's something that is going to be done. Cleaning the hospital so that people can start seeing it normal, whilst there will be those parts that are demarcated. We've seen it that you can demarcate specific area. It's done at Charlotte Matleke. You demarcate a specific area, you work on it. I will not talk about it because we're not hiding, Minister, issues at Tembisa. We have an SIU report that is out about Tembisa, and we're going to act on that. And we want to appeal anyone who thinks that will do what has been done in Tembisa. That person might know that we'll chase that person, because we are not going to allow what has happened in Tembisa in terms of accountability not to be done. There will be accountability here. CEO knows, he sits in our meetings. They know that now every finance manager accounts to the CEO, accounts to the head of department, accounts to the acting CFO that we have in the department. We've changed the way that they were operating, Minister, before. We had those meetings and we had an agreement of how things must be done. So rest assured, my brother, Tembisa is not going to happen at Tambo. It should be completely different. But even Tembisa, we've cleaned it for your information. We've tightened controls. You will not see what you have seen in the previous 3 months happening in Tembisa. Thank you, Minister. I'm not sure if I've tried to add on some of the things that you have raised.
There was a question around the contact in terms of tracing of tracing of missing loved ones, which was raised. There is a number. I'm not sure if you can go through.
Yeah, I wanted to just touch on that as well to say there is a normal way, you know, in government the system works such that when you're missing a family member, the first point of report is the SABC. That's where you primarily report if somebody is missing, because everything is coordinated. But SABC works also with the social workers, with the social development department. So we can advise, because somebody did raise a question of people who may be missing family members. The first point of reporting is the South African Police Service, because they are the ones who coordinate missing persons, and working with, they would be working with health, working with social development, but that's where the center is in terms of the coordination of that. Of course, the question of identification of deceased in this situation is a difficult one. Our forensic pathology division then comes in, and from the reports which we have got, some of the deceased could not be identified facially in terms of just body features. Some were identified. There is a process from the forensic pathology, how the identification happens. There are various categories. You know, whenever there's a disaster, there are ways in which the deceased then get identified through a forensic pathology. Again, starting from, you know, the police, and then from there it goes to the forensic pathology section, and they do those investigations. It is a matter of fact that it can take some time, especially in a fire situation. So it's unfortunate. It adds to the trauma that you know that you have somebody missing, but you don't know whether it's amongst those who have been identified, who have been found on the scene, because there are a number of tests, you know, including DNA ultimately, which is the final determination of whether any of, you know, the bodies which have been picked up may be your loved one. So on that part, we just have to say to the family members that they need to keep in touch with, firstly, with the police, with the social development, the social workers, so that, those kind of tracings can then be done to confirm whether their loved ones who are missing might be amongst those who have passed away. I'll leave it there. But you say there is also a number. You want to, maybe you can just
through the Gauteng provincial government. There is a number that has been set up, which colleagues can. The number is 0800 228 827. 0800 228 827 is through the Gauteng provincial government service delivery hotline. If you are unsure, you could call them, and then you leave your details in terms of who is it that you're looking for, and then your contact details, your address, and so forth, and then they will be able to then also assist with linking up with all other services, as per what the minister was saying. So for those that maybe they might not have their means to contact the other platforms, they could actually use that hotline. There is a dedicated team of people there that will take calls that are specifically related to this particular incident. I'm not sure if I'll take one last round of follow-ups, please. Okay.
But I think before that, another thing that Minister said we must do is to start checking when can we allow visitors to come and visit their families. So we are going to check, CEO is going to check the routes where visitors can go quietly and get into the wards and check the families, those that are here, because there are people that are here already that are getting treatment. But it's something that the CEO will be working on that, because he said, let's not allow people to panic and think that now those that are here are not allowed to visit their own families, whilst they are not part of the process that happened. In fact, they even want to see them. So those are the things that are going to happen including the number that is going to be available, that Mtalatala will indicate, so that they can just call and be able to talk to them and be aware that they are fine, they are still fine. But the CEO is working on that route with the departmental officials, both national and the province. That will not temper on the crime scene. Thank you.
I was not answered around the number of patients that are in ICU.
Do we have that?
What is? There was a
The
number.
CEO.
You mean our ICU?
Well,
Okay.
I did
The
indicate.
patients that came from the incident, they came into our casualty and then they were transferred out. So we've got the names of the patients who were injured and the facilities that we send them to. But we don't know then, and the facilities that admitted them, whether are they in ICU or not. No, none in Tambu.
Yeah. I think what you can indicate, you know, the problem with the bans is that, you know, things can change within, you know, the medical people who are here will tell you the most difficult patient to deal with, especially once you have more than 50% bans. So we may know currently we could be able to establish at Chris Hanibara, Charlotte, any other hospital, how many are in ICU. But I can tell you that in the next few hours, the situation may have changed because it's a kind of an injury. It's much more difficult to manage than a broken bone, you know. So it's something which we will be monitoring, but we really are hoping for the best because especially when you've got a ban from fire, it's even sometimes it's better if it's water. If somebody is banned with hot water, but when it's a direct heat from the fire like this, it's going to be quite a challenge. So it's not surprising that, for instance, by yesterday we had 10 deceased, and already by this morning 3 more people have succumbed because the situation changes very quickly. So I'm sure from our clinical team they will keep monitoring and update the public regularly in terms of what the status is of those who are injured. Of course, the priority will be their families to make sure that they are informed. But I can tell you, this is not a very easy situation. From a clinical point of view, it's a very serious challenge.
Right, that's the Health Minister there, Dr. Joe Pahla, as well as the Health MEC, Nomantu Nkomo Ralihoko, just basically giving an update on the impact of the Boksburg gas tanker explosion that happened yesterday. Of course, just giving us a tally there, 15 people have now succumbed to that gas tanker explosion. And of course, just saying that there was some damage to the hospital. However, it continues to accommodate some patients. Also, what we do know is that, they spoke about how much of a combined and complex effort it will be to clean up following that tragic gas tanker explosion yesterday. And also, at the end of the coming week, there will be a full report on the extent of the damage as a result of that devastating gas tanker explosion yesterday. We're keeping a keen eye on that.